Did you know that one of the most silent and underestimated threats to men's health is lurking just beneath the surface? A condition so common yet so overlooked that it quietly changes lives, often when it's too late to fight back. We're talking about prostate cancer, a disease that doesn't shout but whispers. Prostate cancer is one of the most common cancers in men worldwide, but its symptoms often blend into the background of everyday life. Imagine living with a condition for years, completely unaware because the signs were subtle, almost unnoticeable. It's a reality faced by countless men each year. What makes this even more concerning is that these early signs, these critical warnings, are easy to dismiss. A slight change in how often you wake up at night, a bit of discomfort you chalk up to aging. These could be your body's quiet plea for attention. The question is, are you listening? And if not, what's stopping you? Maybe it's fear, maybe it's stigma, or maybe it's simply not knowing what to look for. But here's the thing, catching it early changes everything. So how do you recognize the signs before it's too late? Let's find out. Understanding prostate cancer. The prostate is one of those organs we rarely think about, yet it plays an indispensable role in male health. It's small, about the size of a walnut, and sits just below the bladder. Its main job? Producing fluid that nourishes and protects sperm, playing a crucial role in reproduction. But this little gland isn't invincible. When prostate cells mutate and begin to multiply uncontrollably, they form a tumor. In many cases, these tumors grow slowly, making their presence almost undetectable at first. But slow doesn't mean safe. Left unchecked, these tumors can grow aggressively, spreading to other parts of the body. Here's the tricky part. Prostate cancer rarely causes immediate, dramatic symptoms. Its onset is quiet, almost stealthy. This isn't the kind of disease that announces itself with sudden, sharp pain. Instead, it begins in whispers, a little discomfort, a minor change. And that's what makes it so dangerous. Understanding how the prostate works and what happens when it doesn't is the first step in recognizing when something's wrong. It's not about paranoia. It's about being proactive. The importance of early detection. Prostate cancer is like a shadow that grows silently, often undetected until it's too large to ignore. In its early stages, it rarely causes clear symptoms, making routine screenings absolutely essential. Yet so many men avoid them. Why? Fear, embarrassment, or simply not knowing what's at stake. The PSA test, for example, is a straightforward blood test that checks for a protein produced by the prostate. If the levels are elevated, it could be a sign that something's wrong. Then there's the digital rectal exam, a procedure that, while quick and painless, carries an unnecessary stigma. But let's break this down. What's worse? A few seconds of discomfort during a routine exam or a lifetime of regret for catching the disease too late. When detected early, prostate cancer is highly treatable. The therapies are less invasive, and the outcomes are significantly better. It's time to shift our perspective. These screenings aren't just about checking off a box at the doctor's office. They're about taking control of your health and ensuring you're around for the moments that matter most. Risk factors. Not all men face the same risk when it comes to prostate cancer. Some factors are beyond our control, while others stem from the choices we make every day. Age, for instance, is a significant player. The risk rises sharply after 50, though it's not unheard of in younger men. Family history also plays a big role. If your father or brother was diagnosed with prostate cancer, your chances increase dramatically. Race is another factor that cannot be ignored. Black men face a disproportionately higher risk compared to men of other ethnicities. Why? The exact reasons are still being studied, but it's clear that genetics and environmental factors are at play. And then there's lifestyle. A diet high in animal fats, combined with a sedentary routine, creates the perfect environment for cancer to develop. On the flip side, regular exercise and a diet rich in fruits, vegetables, and whole grains can lower your risk significantly. It's a sobering reality. While you can't change your genetics or age, your lifestyle choices are well within your control. Small, deliberate changes can make a world of difference.
Diagnostic steps. For those brave enough to listen to their bodies, the next step is crucial: diagnosis. The PSA test and digital rectal exam are the frontline tools, but sometimes doctors turn to imaging tests or biopsies for a clearer picture. These procedures might sound intimidating, but they're the key to understanding what's happening inside. Early detection doesn't just save lives, it improves the quality of life for those diagnosed, because knowing is always better than wondering. Treatment options and managing side effects. Once diagnosed, the path forward depends on the cancer's stage and the patient's health. Surgery, radiation therapy, and hormone therapy are the primary weapons in this fight. Surgery, while effective, can come with challenges like urinary incontinence or erectile dysfunction. Radiation therapy, whether external or internal, targets the tumor, but may leave the bladder and rectum irritated. And hormone therapy, which cuts off the tumor's fuel, testosterone, can bring hot flashes and bone density loss. These side effects aren't easy, but they're manageable. With proper care and support, men can navigate treatment while maintaining their dignity and quality of life. Prevention and lifestyle. So how can we reduce the risk of prostate cancer? It starts with the basics: diet and exercise. A Mediterranean-style diet, rich in fish, olive oil, and vegetables, has shown promise. Cutting down on red and processed meats is another step in the right direction. Physical activity strengthens the immune system, regulates insulin, and reduces inflammation, all factors that help keep cancer at bay. And don't underestimate the power of mental health. Stress and anxiety create the perfect environment for disease to thrive. Managing stress through mindfulness, therapy, or simply talking to someone can make a difference. Cultural impacts and overcoming stigma. One of the greatest hurdles isn't medical, it's cultural. The stigma surrounding prostate exams has kept too many men from seeking help. But think about this. Would you rather endure a quick exam or risk your life? Awareness campaigns are starting to change perceptions, but we need to do more. Talking openly, sharing stories, and breaking the taboo can save lives. The fight against prostate cancer isn't just a personal battle, it's a collective responsibility. By listening to our bodies, breaking down stigmas, and prioritizing health, we can change the narrative. If this story resonated with you, take a moment to reflect. Share it with someone you care about. Spread the word. And don't forget to like, comment, and subscribe to our channel for more life-saving information. Your health, your life. It's worth it.